906%. That is how much treatment for crack cocaine has grown in Ireland since 2017. Not in Dublin alone, not in one neighborhood, everywhere. And most Irish families still do not know what they are looking for. Here is what nobody in the coverage mentioned: a ladder with rungs missing. That is what Ireland's response to this crisis looks like right now. The bottom rungs, the community workers, the local task forces, the people who have been on the ground for 30 years, are being quietly removed. And the families who will need those rungs the most have not been told yet. The Health Research Board published its national figures for 2025 on the 20th of May. 15,422 cases treated for problem drug use in a single year, a rise of 73% since 2017. Cocaine is now the number one drug driving people into treatment in Ireland, accounting for 42% of all cases. It has overtaken heroin. The drug that defined the crisis of the 1980s is no longer the main event. But here's the question the figures raise and do not answer. If the government has known the numbers were moving in this direction for years, and it has, why does the new national strategy arrive without a budget? Why are the people who actually built the response being told to step aside? And here is the part that will not appear in any press release. The communities most affected by this crisis were promised a central role in designing the solution. The draft strategy suggests a very different conclusion. Those are not rhetorical questions. They have specific answers. And those answers tell you something important about how this system is designed. Quick pause. Has this touched anyone close to you? A family member, a neighbor, someone from your town? Drop it in the comments. Not to be intrusive, because the numbers in this story have faces behind them, and I think you know that already. Because behind every number in this story, there is exactly that, a family that did not see it coming. There is a 27-year-old man from County Clare who spent time at the Cuanvora Treatment Centre in Athy, County Kildare. His story was reported by RTA this week. He had taken almost every drug available to him. He was not homeless. He was not visibly falling apart. He held his life together on the surface for long enough that the people closest to him did not see what was happening until it was nearly too late. His mother described not knowing what to look for, not because she had not been paying attention, but because the signs she had grown up associating with serious drug use did not match what was in front of her. 90% of the patients currently being treated at Conware in Athy are there for cocaine addiction. 90%. In a single treatment center in County Kildare. The public version of this story is accurate. It is also incomplete. The incomplete part is this. The cocaine crisis of 2026 does not look like the heroin crisis of 1985. In the 1980s, the crisis had a geography. It had a face. It was concentrated in specific streets in inner-city Dublin, in specific communities in Cork. The social and economic conditions that fed it were visible. Parents who grew up watching that crisis developed a mental image of what serious drug use looked like, and that image is now decades out of date. A publican in Dunmore, County Galway, told RTA that a decade ago, drug use in his area was rare and anecdotal. Since COVID-19, he said, the picture has changed completely. Every demographic, every age group, people his own age who he felt should know better. For those watching from the United Kingdom or the United States, this is the Ireland that exists right now. Not the Ireland many of you left, where this kind of crisis belonged to specific streets in specific cities. This one has no postcode. Dr. Colin O'Gara, one of Ireland's leading addiction specialists, has warned that people are now beginning to use cocaine in their 60s, in rural GAA towns, in farming communities, across every part of the country. Young people in their 20s and 30s are presenting with heart attacks and strokes. The Health Research Board data shows ketamine treatment has increased 12-fold since 2017. These figures are national, and this is precisely the detail that changes everything. The family sitting at the kitchen table in Roscommon, or Tipperary, or Sligo, watching a son who seems stressed, who seems tired, who seems to be having money trouble, is not wrong to be worried. They are simply working from a map that no longer matches the territory. The new presentation of cocaine dependency often looks, from the outside, like burnout, irritability, withdrawal from family routines, financial difficulty that does not quite add up. A person who is still functioning, still going to work, still showing up, but slowly losing the thread. By the time the real picture becomes clear, the dependency is often already serious. That is not a failure of Irish families. That is a failure of information. Everything we have just covered, the scale of the numbers, the changed face of the crisis, the gap between what families expect to see and what is actually in front of them, that is only the first part of the problem. The second part is what happens when those families finally reach for help. The Irish government spent €176 million on drug services in 2025. The crisis grew by 73% over the lifetime of the strategy that spending was meant to support. Minister Jennifer Murnane O'Connor published the draft National Drug Strategy for 2026 to 2029 in February. The document sets out 5 strategic pillars. It references the Citizens' Assembly on Drug Use from 2024, which spent months gathering evidence and producing specific recommendations. It does not contain a budget. That is not a detail. That is the document. The work of local drug and alcohol task forces, 14 groups established 30 years ago, working directly inside the communities most affected, reviewed the draft and said it would, in their words, unravel decades of life-saving work. Their concern is that the new structure centralizes decision-making inside the HSE, removing local task forces from the implementation process. These are the organizations that built the ground-level response, the people who understand the difference between a crisis in Darndale and a crisis in Clonakilty, because the context and the required response are not the same. This channel exists because these details deserve more than a press release summary. If you want the full picture, without the spin, subscribe. And now, here is where this actually lands. Deputy Gary Gannon said the draft strategy speaks of services that do not exist. The final version is expected before the end of summer 2026. That window is still open, just. And what closes with it, if the task forces lose their role, if the budget does not arrive, is not an abstract policy outcome. It is the phone that does not get answered, the waiting list that gets longer, the family that falls through the gap. But all of that is still abstract. Here is what it actually means for the household that pays the bill. When a family finally pieces together what is happening and reaches for a phone, the system they reach into has a waiting list measured in months, a task force that may no longer have the same role, and a strategy that has not confirmed its own funding. An Irish parent in 2026 is being asked to recognize a crisis that does not look the way crises are supposed to look, using information that has not been adequately distributed, while the safety net is being restructured without a budget. The ladder is missing rungs, and the families who need it most are only now realizing they are climbing. What can be done right now? Family Addiction Recovery Ireland, FARI, is a coalition of 80 organizations working directly with families affected by addiction across Ireland. The Family Addiction Support Network, FASN, operates a 24-hour helpline at 087-904-6405. These are not government programs. They are the bottom rungs of the ladder, the ones the draft strategy is quietly removing. They are still there, for now. The final national strategy arrives before the summer ends. Whether it comes with real funding and whether those 14 task forces keep their role on the ground will determine what kind of response exists for the families sitting in that kitchen, the ones who are only now starting to understand what they are looking at. Watch the final strategy. That is where the answer lives.